Treatments for Diabetes and Weight Gain. Copyright Endodiabetes Limited 2020. Disclaimer. This video is for information purposes only. It is aimed at the general public and health professionals. Do not start the medications of your own accord or stop the treatment prescribed by a health professional before discussing and finding the alternatives. Type 2 diabetes and weight. Type 2 diabetes mellitus is usually associated with excessive weight and a high BMI. A body mass index of 25 is associated with a twofold increase of risk of diabetes in men and eightfold in women. A body mass index of 35 increases the risk by 42 in men and 93 in women. Type 1 diabetes mellitus and weight is a different story altogether. Because the body lacks insulin, there is weight loss preceding diagnosis of the disease. Starting insulin restores normal metabolism and helps regain lost weight. Type 2 diabetes mellitus treatments and impact on weight. Medications used for the treatment of type 2 diabetes mellitus associated with weight loss are discussed separately. In this video, we will discuss treatments for diabetes that can cause weight gain or are weight neutral. Weight neutral medications are DPP-4 inhibitors, such as sitagliptin, saxagliptin, etc., when used as a single treatment, i.e. monotherapy. Alpha-glucosidase inhibitors, such as acarbose. Medications associated with weight gain are sulfonylureas like Gliburide, Gliclazide, Glipizide, etc., glinides like natiglinide and repaglinide, TZDs such as Pioglitazone, and insulins. Before discussing weight gain, let us mention UKPDS. UKPDS was a landmark clinical study where 5,102 patients with newly diagnosed type 2 diabetes mellitus were tried on various types of medications for type 2 diabetes mellitus to see how complications might be prevented. The study concluded that reducing glycemic exposure, as measured by HbA1c, from 7.9% to 7% reduces any diabetes-related endpoint by 12%, microvascular disease by 25%, and a 16% trend towards the reduction of myocardial infarction. Sulfonylureas and insulin in UKPDS, HbA1c and weight. There are quite a few drugs in this class, for example, Gliclazide and many more. Sulfonylureas have been shown to improve HbA1c in various trials. In the UKPDS study, clopropamide and glibenclamide were compared to diet and insulin. The starting HbA1c was 9.1%. Let us go through the results. While the control group gained 1.7 kilograms in weight, patients taking sulfonylureas gained an average 3.5 kilograms during the trial. Those taking insulin gained just under 5 kilograms. The HbA1c results are in the yellow bars. The improvement in long-term sugar control was also significant compared to the control group. To summarize, the weight gain was 3.5 and 4.8 kilograms in the sulfonylurea and insulin groups respectively, while the improvement in HbA1c was also significant. UKPDS indicated that there is no doubt that tighter glycemic control improves outcomes in type 2 diabetes mellitus, that treating high sugars in type 2 diabetes mellitus brings benefits and reduces neuropathy and retinopathy, and yields a trend of reducing heart attacks. As we have seen, some of the classes of medications used in UKPDS, namely sulfonylureas and insulin, have been associated with low blood pressures and weight gain. TZDs, Pioglitazone. Pioglitazone is the remaining medication in the class of TZDs. It has been associated with a weight gain of 1.5 to 3.6 kilograms, depending on the trial. This is actually extra abdominal fat. The same data with weight gain is given in pounds. The pros of Pioglitazone are that it is an effective treatment for type 2 diabetes mellitus. It will reduce HbA1c by about 1%. Pioglitazone has been shown to have cardiovascular benefits in trials, and it lowers blood pressure and some of the lipid fractions. The cons of pioglitazone are that fluid retention is a side effect, and this can lead to heart failure. There is an increase in bone fractures, and some studies have suggested a weak link to bladder cancer. Mitigating weight gain. The combination with metformin will help with weight gain with all of the classes of drugs mentioned in this podcast. Metformin may not be easily tolerated by all patients because of the gastrointestinal upsets. Metformin also should not be used in patients with renal failure, an eGFR less than 30 millilitres per min per metre squared. Sulfonylureas combination with metformin. This study has looked into the weight differences between patients taking Gliburide, metformin, and the combination of the two medicines. Weight gain in patients given a combination of Gliburide and metformin was smaller than would be anticipated from the UKPDS data. The addition of metformin versus oral monotherapy. As we can see, there will be weight gain if sulfonylurea, glycine, or TZD are added to metformin, but this is less than would have been expected from monotherapy with its classes of drugs. Insulin. Basal means injecting long-acting insulin once per night, so Detamir or Humulin 1, etc. Biphasic is twice-daily insulin that has short and long-acting insulin components, Novamix 30, Humalog Mix 25, etc. Prandial, short-acting insulin with meals only, Novorapid for example, or Humalog, 3 times daily. As we can see, basal insulin causes the least amount of weight gain, 1.9 kilograms, versus 5.7 kilograms caused by prandial insulin. Biphasic insulin will cause less weight gain than prandial, but more than basal insulin. Combining biphasic insulin with metformin will still result in less weight gain compared to the addition of a drug that affects the sulfonylurea receptor, such as Repaglinide. The addition of metformin will result in 2.2 kilograms versus a 4.7 kilogram weight gain. In summary, sulfonylureas, TZDs, and glycides, and various insulins are treatments associated with weight gain when given as a treatment for type 2 diabetes mellitus. Although associated with weight gain, these medications reduce and prevent the development of complications, notably microvascular retinopathy, neuropathy, etc. The addition of metformin, where tolerated or not contraindicated, can mitigate the weight gain. Thank you for watching. Copyright ended